Hi, I'm Lisa Leiter. In Chicago Business Today, Ventas, the Chicago-based healthcare real estate investment trust, last month bought Lillibridge Healthcare Services in a deal valued between $300 and $400 million. Lillibridge is the biggest private owner, manager, and developer of medical office buildings in the country, and Ventas sees it as a big growth area in the face of healthcare reform. Ventas stock was the top-performing financial stock of the past decade, returning 2,000% to shareholders. I recently talked to Ventas Chairman, President, and Chief Executive Debra Cafaro and began by asking her what attracted the company to Lillibridge.
Ventas is a very large healthcare REIT, as you know, with about $10 billion in healthcare and senior housing assets. One of the areas we have identified as an important strategic growth area for us is the medical office building sector. And Lillibridge is the largest privately owned medical office building owner, developer, manager in the United States. And the fact that they have a great management team that's based here in Chicago was also an attraction. If we want to be a leader in the medical office building space, then acquiring Lillibridge was the absolute perfect move for us.
Do you have your eye on other companies? Are you planning more acquisitions this year?
Well, we rode through the financial crisis well, so we weren't making a lot of acquisitions then, but we did get our investment team geared up again in the fourth quarter of '09, and we are actively working on a number of potential acquisitions.
Are acquisitions key to your growth strategy going forward?
Well, we grow internally and externally. So one great thing about healthcare is that Ventas has always delivered growing cash flows, even through the recession. And our assets are very productive, and we expect them to continue to be productive. So we will have good internal growth, but then we should expand that by creating growth from acquisitions as well. And that's always how we've been able to deliver superior risk-adjusted return to shareholders.
Hospitals have really been trying to become more efficient. They don't want to be in the business of owning real estate. Has that trend really helped your company, and do you see better opportunities now than you would have, let's say, a decade ago?
We believe there will be a big trend as cost pressures on hospitals increase, as they need to be more efficient, as more procedures are done outside of a hospital, that there will be a move of making all of this massive amount of real estate get out of the hands of hospital owners and into the hands of more efficient owners like Ventas. And getting back to Lillibridge, that was a main reason that we wanted to buy them, is as this trend becomes a reality and as it accelerates, which we believe it will, we want to be in a position to be the leading MOB provider in the U.S. And the combination of Ventas and Lillibridge allows us to do that.
Do you see healthcare reform being a benefit to your company?
It should be a benefit in two ways. One is as the uninsured come into the system and become covered. That's 32 million people who will enter the healthcare system in a more normal way, i.e. in a medical office building versus, say, the emergency room. That will increase demand for medical office, and again, with Lillibridge, Ventas can now develop new office buildings. We expect 30% growth in the medical office building sector over the next 10 years. So that's one way. And then secondarily, healthcare reform is all about getting things done in the lowest expense, most clinically appropriate setting. So by and large, that means getting patients out of the hospitals and maybe having that procedure in these ancillary care buildings, which is what Lillibridge owns and what Ventas now owns. And so that too will continue this trend of making the medical office and outpatient a really great place to be.
So you still see that 30% growth even though we have commercial real estate vacancy rates so high right now. I mean, can't some of that vacant space go toward, medical offices?
Two things. One is healthcare real estate has some of the best fundamentals in any class of commercial real estate, and that's because demand is there. And what's lacking in some of the other commercial real estate sectors now and for the foreseeable future is the demand just isn't there. Now, what doctors and physicians want and patients want is really to be on or around a hospital campus. And of the 95 buildings we acquired with Lillibridge, 92% of them are on hospital campuses. And physicians really like that because they can go discharge patients, they can go back and forth to perform surgeries and so on. So we think the main growth area in medical office will continue to be in and around hospitals, and that's again another reason we like the Lillibridge portfolio.
So you recently, about 2 years ago, moved the headquarters of the company to Chicago. Are you planning more expansion here in the city? Are you planning more hiring here in the city?
Well, with Lillibridge, we're adding over 200 employees, so that's really great. And as we continue to expand, I think we will continue to hire. We're very happy to be here in Chicago. It's a great real estate community, and it was appropriate for us as we joined the S&P 500 to really be part of such a great business and real estate community.
Okay. Well, yeah. Deborah, thanks so much for joining us today.
Thank you, Lisa.
We appreciate it.
I appreciate it.
And that's this edition of Chicago Business Today. Be sure to check out all of your breaking news at chicagobusiness.com. Thanks for watching. We'll see you tomorrow.